how much money is spent on management consultants by different NHS trusts. So management consultancy is quite difficult to define, and there's lots of views on this, but essentially they're external experts that provide support to people. Now sometimes that support's in terms of expertise, but sometimes it's also in terms of legitimating, sanctioning, giving credibility to things that they've decided already. The ultimate aim of this research is to help us understand what happens when consultancy is used, and then how we can help improve that. The project is a team of us working from the Universities of York and the Universities of Bristol, and then also a researcher who is an insider within the NHS at national and also regional level that allows us to work with people at different levels. There are three parts to this research project. The first part is a quantitative approach to research, which is looking at how much is spent by NHS trusts or hospitals and what the outcomes are in terms of numbers, in other words, of efficiency and effectiveness. And we did that by looking at individual trusts right across the board to over 120 NHS trusts, and then compared that with data from the NHS in general. The second element, which is the qualitative element, there you get into politics, doing interviews and observations within NHS trusts locally to try and find out what are the reasons behind some of these relationships, what are the factors that help support good use of consultancy and what undermine those sorts of things, right from the top of the NHS to individual hospitals. If I were to commission a firm of consultants and it went horribly wrong, I'm going to be the last person to acknowledge that it went horribly wrong because it reflects on me. And so we looked at what factors help to reduce that. And one of the main ones there was having clients who were experienced in using consultants, so-called intelligent clients, who could try and ensure that they got the best out of the consultancy use. The third and final part of the project, which is what's going on now, is about impact. It's about leveraging or using our research to help actually affect change within the NHS. When we put the numbers into the number crunching machines, in other words, did our analysis, we weren't sure what was going to come out. We found, in fact, that consultancy is associated with an increase in inefficiency. Most people see the use of management consultants as a substitute for managers that don't exist or they're cut down. And we found that the greater use of consultancy was in those trusts that had more managers. And so we dug deep behind that to try and identify what was going on there. And we found that that was the case when the managers were quite general and not specialists themselves. So we found that where there are more specialist, if you like, internal consultants, then there was less use of external consultants. So most people don't have data on what the outcomes are. So our data around inefficient outcomes is really powerful to highlight what many critics of consultancy have said, but they haven't had the data to back it up. What we're doing at the moment is trying to work with different groups within the NHS to engage those people who are highly motivated to try and do something about this, so that hospitals and the NHS in general can make more effective use of consultancy, can learn more, and then also consider using internal sources. Management consultants are notoriously difficult to define. People disagree on that. But it has a much wider significance in the sense that management consultants have a big influence on shaping our lives across a whole range of sectors. And if we can help to make more effective use of consultants, then we can learn some good practices, things can be improved, money can be saved. If we can help affect savings within the NHS, that's going to affect their healthcare directly.